What's up everyone, Dr. Nate here with Catalyst. Today we're going to talk about lower back pain and a few different exercises that you can do to potentially help with that. Now, disclaimer, there's not one specific exercise that will help with it necessarily. Sometimes there is, and I'm just going to show you a couple that might be able to help with it. If you have progressive numbness, tingling, and weakness and bowel and bladder changes, then those are progressive neurological deficits that you're going to want to get checked out immediately. So please go and consult your physician. If you're working with a physical therapist, please tell them about that, because that's something you need to get checked out right away. Again, so there's not one specific exercise that may work for you. I have not evaluated you, so just take these with a grain of salt, test them out, see how they feel. If there's one that makes it feel better, great. If there's not, then you might need a little bit more of an elaborate approach to finding what works for you. Okay, so I'm going to show you 3 different movements. The first one is super simple. It's just sitting on a box like I have here, or a chair. What you can do is just scoot to the edge, and you're literally just going to bend forward trying to touch the ground. Now if you can't touch the ground, that's fine. The chair height might be too high, it might be too low. Just go as far as you can down comfortably. Try 10 of these and see how you feel. Now, if it feels worse after doing that, then that's probably not the right exercise for you, right? So you want to find something that actually feels better. Now, sometimes it'll hurt in the first couple reps, but then it feels better towards the end. So you want to make sure that you're doing enough reps to figure that out. Sometimes it's more than 10 reps. You can even try 20, depending on the severity of your symptoms. The second movement that I want to go into is actually a backwards bend. So you don't have to get onto the floor for this one. And you can do it like so. So hands are going to be on your hips. You're just going to be bending backwards. Now you don't have to bend as, super far back necessarily, but just see how you do bending backwards through a smaller range of motion and then slowly pushing into a larger range of motion. And this is just a good way to test your extension tolerance. If you're having issues with walking, typically this is a movement that can feel uncomfortable because walking does require some spinal extension, right? So with this motion, I'm actually getting hip extension and I'm getting back extension. So we want to see if we can improve those 2 things if you're having pain with walking. So this is a good one to work on if you are having that issue, as long as, again, it's not flaring things up. Sometimes you won't know until the next day, so start small, just a couple sets, like 2 or 3 sets, 10 to 15 reps, see how you feel, and then progress from there. Again, if you can't figure out what works for you, you should definitely work with a professional. The third one I like to do, and this one is, it's a little bit more involved. It's on the floor, so I'm going to get down onto the floor. Now if you can't get onto the floor because it hurts, then I probably wouldn't recommend this one. Or you can't get onto the floor and then you can't get back up, that's a problem. So this one you have to be able to get onto the floor for. It's called a bird dog. And this is very common in like McGill's Big 3 and a lot of other programs. It starts by just kicking your leg back and then bringing your opposite arm up. Okay, you hold that for about a second or 2, like so. And we're just going to be alternating doing this exercise. And again, this should not be severely painful. It should be relatively comfortable. If it's a little bit uncomfortable, that's fine, as long as it's not irritating things to a point of severe discomfort. So that is the, yeah, that is the main thing. Make sure to test those out, see how they feel. Please like this video, subscribe to the channel, and ask any questions below if you have any questions about these exercises. Take care, and I'll see you in the next video.